Minister. I'm sure you remember the private member's motion that the technical group had down in the first 6 months here in the Dáil, and it wasn't put to a vote. It was just a marker was basically put down as to what we would like to see happen, and we left it at that, and we said we'd revisit it. Now, I have an interest in this area from a personal point of view. I suffer from mental illness myself, contemplated suicide at one stage in my life, and I made it quite clear when I've spoken about this that one of my biggest fears was approaching the mental health services. I thought it was interesting what you said here today. You said when people reach out, there should be help. No one can disagree with that. The environment should be enabling and not disabling. No one can disagree with that. And all we can do is ensure people will know what to do or exactly where to go. I wish I didn't have to say what I'm going to say here now, but I have to say it. People don't have that assurance in the county that I come from. You know, people will say, oh, that's parish pump, just talking about your own county. It's not. It's the area that I know best. It's the area that people are coming to me about. And far from feeling reassured about it, we have, for the past 3 weeks, in all of our local newspapers, articles which are true, which do anything but reassure people. I'll give you just a little taste of what people are saying. I'm sure you've read the Roscommon Herald this week, and I know what's going on, and you know what's going on in Roscommon Psychiatric Hospital. We have a family member there at present when the incidents took place. I hope you're aware of what the incidents are. Can you just imagine what this is like for the staff, patients and their families? Was to be brought up in the Dáil, well, we tried to, but our topical issue kept being refused, including today, and that the workers are doing terrific work, and we don't want them criticised, but they're working in appalling understaffed conditions. This must stop right now. The authorities have been told this will happen, and I know they had, and they were warned, and there will be more of this. I am pleading with you to get this appalling situation addressed immediately. We have now got a situation in Roscommon, or maybe it's the same all over the country, I don't know, but I do know it's happening in Roscommon, where people do not feel safe about the prospect of approaching the mental health services. We have a situation where the local services are now losing staff because they need them in the psychiatric unit, and people do not have the service locally. And we know what the knock-on effect is. Then they end up a little bit worse, and in many cases have to go into that hospital, which they do not feel safe going into. And I hate having to say this, but they're right in not feeling safe about going there. And something needs to be done. Because I'll tell you, my fears that I had all those years ago, they have not been allayed. Have not been allayed at all. I wish they had. But it's quite clear that psychiatric services are still the poor relation when it comes to our health services. I have had no one contact me to tell me that their brother or their son or their sister have been left on the side of a road with a broken leg for a year and no one take any care of them and let them get worse and worse until they die, because that's what's happening to people. Now, we talk about why people end up with mental health problems. We now have a situation in Roscommon Psychiatric Hospital where the workers are starting to develop mental health problems because they are under such massive stress. There is a public meeting in Roscommon town tomorrow night to discuss all of this. And all I can say is, we don't really know where to turn. And the fact that it isn't picked up as a topical issue, this isn't about me or Dennis Naughton, I understand, put one in as well. It's about us trying to do something about this. And this is an end-of-pipe solution. I'd love to talk about the other reasons why people end up there, but I don't have the time. But when people end up the end of this pipe, it seems like they're just being sent into the sewer. And what is happening about this? I come from a family who had forced shock therapy in a variety of different scenarios. And I'm not seeing that it's improving. And it hasn't improved. And I fear for anyone who has to use the mental health services in my county. And I want to know that you're going to do something about it. And the last thing I want to hear is that someone would suggest this is some sort of political football. It's not. It's not. It affects me, it affects my family, it affects my neighbours. And I would have to say, up until now, Minister, you talk an amazing talk. And I don't know who's stopping you doing the walk that I actually believe you want to do. But it's not happening. And I'd like something done about it.
Deputy, thank you. I mean, very quickly, the Minister, we've taken our 5 minutes, so we're...
The Minister will allow me, Chairman, because it's very important.
Yeah.
I forgot about it, and I shouldn't, because it was very important. You do realise, Minister, that we have a situation in Kerry General Hospital in the psychiatric ward there, where people working were recently attacked. Very unfortunately, 3 people seriously injured, and that, just in case that you might think, well, that was a once-off occurrence. It has been happening since St. Finian's and St. Peter's ward have closed, and it is because of the fact that we do not have a secure unit in the psychiatric ward section of Kerry General Hospital, and that's a situation that needs to be addressed as a matter of urgency. Thanks for allowing that.
Minister, you've been more than good. It's been
thank you very much.
Time you
could I just start with I don't think that that we're going to go backwards in terms of our mental health provision. The plan is, and a vision for change clearly states that we're going to have a community-based mental health service, and that the big institutions that did exist were to be closed and have been closed, and I think that's important. I think the notion, as Dermot Walsh told me when he came in to talk to me, that we had 22,500 people in institutions in Ireland. You know, we couldn't possibly have had that many people with that type of acute mental health issue. That couldn't have been the case. You know, there must have been something else going on there, and we don't want to leave that situation continue, or indeed go back to it again. In relation to the RSA style, we have a national office for suicide prevention. And that's exactly what it's called. It's called the National Office for Suicide Prevention, in the same way as the Road Safety Authority is the national office in relation to road safety. But, you know, there are 2 entirely different areas. You know, it would be lovely if we could introduce laws to prevent people from self-harming and, you know, from dying by suicide. I don't think any of us want to go there. None of us want to go there anymore. The Road Safety Authority can do that. They can improve the road network, they can introduce penalty points. That all has an impact on people's behaviour. We don't want to do that when it comes to suicide. We did that for too long, and I don't think it was beneficial, and I don't think any one of us want to go back there. You know, we have an office for suicide prevention, and I think people should stop talking as if we didn't. You know, and I don't think that what works in the National Road Safety Authority would actually work in relation to suicide. And I think when people would sit and think about it in an in-depth way, they would realise that. And, you know, I just would appreciate if people did that did think about it in a serious way. And I think, I'll be honest about it, I think it's insulting to continuously talk in this fashion. In relation to career guidance teachers, we introduced a whole-of-school approach. Look, very briefly, Chair, we had a group of people over from Sandwell to talk to the Irish College of GPs recently, because we've done a piece of research with the Irish College of GPs as well, and research, and there's a DVD produced by the college that will go to every single GP in the country, and it talks about depression and suicide and how to recognise it and what's the best possible approach to take. And the people from Sandwell that came over, they actually take a whole-of-community approach to mental health, an entire community. They bring in the churches, the schools, the traffic warden, anyone in the community that has interaction with other people on a regular basis. And, you know, they convinced us that really and truly it's a whole-of-school approach. You know, if I have a difficulty and I act out in class, as happens every day of the week, it may be because I simply don't want to be in school, but it may be another reason as well. There may be some underlying stuff there. But do I really want to be going to the one office that is identified as the place you go when you have a problem? Do you want to do that? Surely it should be about being able to approach anyone into school. Surely it should be about that. What if you don't get on with a particular individual in the school? Are you saying that there is nowhere else that you can turn? I appreciate that career guidance teachers have done an incredible job in this country, both doing their own job and indeed being an open door in terms of kids who are distressed. But it has to be more than that. It has to be more than that. You know, it has to be a whole of school approach. It has to be more than that. Could I just, Deputy Flanagan, I'm not certain that I can give you any answer to the issues you raised here today, but you can take my word for it that I will take a serious look at it. You know, because people sometimes find themselves acutely distressed, then quite clearly incidents will occur. You know, incidents will occur. And I think the professionals that work in the area are conscious of that. They're definitely well trained in the management of those issues, and not alone that, but they're equally, you know, when they go into this as a profession, and it is a very highly skilled profession, then, you know, they know that there are dangers accruing to that. Less than in some other areas, I would have to say. I would say to you that at the end of the day, and Deputy Healy raises the point of assault as well, that the A&E department of any hospital on a Saturday night could be equally as dangerous. You know, we need to be conscious of that. I would have to dispute what you say in terms of, you know, warning people against approaching the services in Roscommon. And, you know, I will take a look at the particular issues you're talking about. I would.
What the staff are saying, I am not saying it.
Well,
that would make a great headline, wouldn't it? That I'm saying that. I am not saying this, and I actually don't think we're taking it seriously. Sorry.
Deputy Flanagan.
Yeah, but there could be someone dead out of this, so I've got to push it.
Well, Deputy Flanagan, you know, that type of rhetoric and that type...
Could be. They are the words from the Psychiatric Nurses Association.
Sorry, can I just suggest, Minister, to be helpful? I think in fairness you didn't have advance notice of this particular issue. If you could undertake to just get back to the Deputy directly, and similarly in terms of Kerry.
I cannot see how that is possible, that you would not have known about this, and if you didn't know about it, that's even more worrying.
Well, I have to adjudicate as Chair. I'm asking the Minister to come back to both deputies when she's had a chance